Of that cerebral hemisphere, just where those two hemispheres actually communicate with each other, and that's going to be via the corpus callosum, okay, which is this more superior band of tissue here, the white tissue there, the corpus callosum. You can be sure you're looking at the corpus callosum if you're looking at that band of tissue that's immediately superior to the lateral ventricle, this space here. So we'd be full of cerebrospinal fluid at that location. Okay, that cerebrospinal fluid is going to go down through that interventricular aperture that we said we can't see, down into the third ventricle. Right, the third ventricle is this depression that circles around the thalamus. Okay, so here, lateral ventricle, corpus callosum, down through the interventricular aperture into the third ventricle, which circles around the thalamus. If that's the thalamus, what would this be here? Just inferior to the thalamus. Hypothalamus. Let's follow that cerebrospinal fluid from the third ventricle down through the cerebral aqueduct. Well, you can see this kind of little depression here from the third ventricle through the cerebral aqueduct. And we can be sure we're looking at cerebral aqueduct if we're between two things, the cerebral peduncle and the colliculi. Okay, so from this longitudinal section, all we can really see is the superior colliculi. The inferior colliculi is a little bit lateral. Okay, so if you recall, that superior colliculi, right down the midline, these inferior bulges are a little bit more lateral, so you can't really see those in the longitudinal section. Okay, so here we go. Lateral ventricle from the corpus callosum down through that interventricular foramen into the third ventricle, circling around the thalamus. Look inferior to the thalamus, you've got the hypothalamus. Yeah. If we go posterior from the thalamus through that cerebral aqueduct, we're going to pass the superior colliculi and the cerebral peduncle. If you follow that cerebral aqueduct, once you're underneath or inferior to the cerebellum, that's when you're going to be in the fourth ventricle. Okay, so here we're in the fourth ventricle. And the fourth ventricle sits again between that cerebellum. And look at this prominence here. That's the pons. Okay, so we got pons, cerebellum. Posterior to that, we'd have the
medulla oblongata.
I was hoping Sergio would hit us here. Give us your best impression. Pons, medulla oblongata, spinal cord. Okay, the central canal of the spinal cord, if you section it at just the right spot, you can see it. Just realize that it is continuous with the fourth ventricle. You can kind of see a little impression there, but I'm not so happy with it. So just realize that the central canal is going to be passing right through the middle of that spinal cord, right? Communicating with the fourth ventricle, carrying cerebrospinal fluid in the inferior direction. Okay. One thing we didn't talk about was our cerebellum superficially. So we got our cerebellum there. If you look inside of it, that's where you can really appreciate that the arbor vitae of the cerebellum, right? That tree of white matter coming through the gray matter. Okay. Also, if you look at this cerebellum, we can see the left and right hemispheres and the vermis right down the center. The vermis is a little more pronounced in sheep than it is in humans. So it's very, very clear here. Vermis and then your two hemispheres. Okay. That takes us through the longitudinal section. Again, all things that you guys are looking at in the human brains, but it's nice to see the real thing, right? Get a real appreciation for some of the color differences. Let's see if we can pull any